The Dental Download podcast is your source for insight into dental school, conversations with dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Haley Schultz. Let's get into this week's episode. Want to make a podcast? Spotify's got a platform that lets you make one super easily and then distribute it everywhere and even earn money, all in one place for free. It's called Spotify for Podcasters. Here's how it works. Spotify for Podcasters lets you record and edit podcasts right away from your phone or computer, so no matter what your setup is like, you can start creating today. Then you can distribute your podcast to Spotify, but also everywhere else podcasts are heard. Video podcasts are also available, and you can earn money in a variety of ways, including ads and podcast subscriptions. Did I mention it is totally free, no catch? I've been using Spotify for Podcasters since the very beginning of my show, and now we're nearing our 200th episode, so I can definitely say it's an easy platform, and I've really loved using it. So be sure to download the Spotify for Podcasters app or go to www.spotify.com/podcasters to get started. All right, hi everyone. We're back with another guest here today, and I'm going to let Raina introduce herself.
Hi, my name is Raina. I am a third-year dental student at Texas A&M College of Dentistry. We actually just changed our name to Texas A&M School of Dentistry, so I have to get used to saying that. But I did my undergrad also at Texas A&M University in College Station, and then I did my master's at UNT Health Science Center in Fort Worth before coming here to dental school.
Thank you for that intro. I'm excited to get to know you a bit more and kind of unpack your process of getting into dental school and how the past 3 years have been going. I'm sure we can compare and contrast experiences a little bit there too with clinic and pre-clinic and everything. So kind of starting chronologically, when you first got going, what was your pre-dent journey like? When did you decide on dentistry? What made you end up doing the master's? How did all that work?
Yeah, so I always knew I wanted to go into dentistry. My mom is actually an assistant for an oral surgeon her whole life. So she did that in high school and got her technical degree for that. So I was introduced to dentistry at an early age. I was very fortunate that the doctors that she worked for, they let me come in the summers and help out and just kind of like learn the ropes. So I always knew that I wanted to go into dentistry. Whenever I started doing my pre-dent journey in college, it didn't go as planned. I was not as prepared for college as I thought I was going to be. So there was a few bumps in the road. I didn't start out making the grades I wanted to, and it wasn't a lack of trying. It was just a lack of, I don't know what I'm doing. I knew very early on that I was probably going to have to do a master's program just because my first 2 years of college, me being very vulnerable, they weren't where they needed to be. I remember sitting in pre-dental meetings and they have like the deans at the dental schools come and talk to you. And I specifically remember one of the deans saying, y'all need to make sure y'all have mostly A's. Like, it's okay, some B's, but mostly A's. And at that point I was like, oh my goodness, I made some C's. Like, what am I going to do? And so it didn't deter me from wanting to be a dentist. It just deterred my path. And so I ended up doing a master's program at UNT Health Science Center. The best thing I ever did. And the way that works is we take classes with the med school professors. So they teach the same exact first year classes to the med students as they taught to us. And so therefore we kind of like prove ourselves that we can do the rigorous load. And so by that point I got college under my belt and I knew how to study and how to prepare and everything. And so the first time I applied to dental school, I got waitlisted. And then the second time I ended up getting in. So that's kind of where my journey was as a pre-dent.
Did this waitlist time to the time getting accepted, was your master's in between that? Or did you already have the master's the first cycle?
Yeah, so I applied to my master's. I started in spring of 2018. And that same summer, I applied to dental school without having my master's under my belt. And so I spoke to a lot of different advisors, and one of the advisors like looked at my transcript and all my extracurriculars and everything. And she said, pretty much, you are like the prototype student who gets in the second time. And she's like, I hate saying that, but like you probably won't get in your first time. So the first time I applied, knowing that, hey, I'm not the all-star applicant who's probably going to get in, but I needed to show that I was going to keep on trying no matter what. And so I gave it my all. And like I said, I got waitlisted that year. But then the second time I applied, I had finished my master's, had that under my belt, and got in.
That's good. So what were some of the things you did as a pre-dent? So like you had to make up for the grades with the master's, but like what other clubs were you involved in or service that you think like helped your application a lot?
Yeah, so there's a few things that I think that helped my application a lot. First of them being that I was working in a dental office starting in high school. So every summer, every break, I was in a dental office, and I spoke with deans, and they were saying, they're like, that's not what gets you in, but that does help you stand out. So the fact that I wasn't only in general dentist office, I was in oral surgery offices, orthodontics offices. So like once they accepted me, they knew that was something I really, really wanted to do. I was also involved in service organizations. I tried to do things that I really enjoyed. And so the thing I was most passionate about in college was an organization we had called The Big Event. And so it was started at Texas A&M, and basically every single student could be a part of it, a one-day huge service organization. And we go around the community to almost every single household in the city, and we ask them, hey, what can we do for you? It's not based on socioeconomic level or anything like that. Just almost every single person in the city who is a resident is asked what we can do for you. And we send out college students on that one day to help them. And so it could be yard work. It could be painting the inside of their house. It could be, hey, I don't really get to talk to anybody. Could you just have lunch with me that one day? And so that was something that I moved up in and became on leadership team for. And so that was something that I think helped me stand out, but more like for the fact that it made me stood out because I was really passionate about it and really, really enjoyed that. So yeah.
I totally feel you there. Like I always tell the pre-dents, like do something that you love. Like if you're doing a service, like do service with a community that you love, or you love like the idea of it. Like if you really are passionate about like elderly population, work with them. If you love children, work with them, whatever it may be, because it's easier to get yourself to fit that into your busy schedule when you actually enjoy it. And it can show through, like you're saying, in your application cycle, when you're just so excited, when you're talking about it, that shows them that like you're a really genuine person.
Yeah, I definitely agree. Because pre-dents ask, they're like, oh, so you did this, should I do that exact thing? And I'm like, no, like find something like service oriented that you actually enjoy. Like you're gonna not only have to do it every week, but you're gonna have to like talk about it. And you don't want to waste your time in college doing stuff that you didn't enjoy.
Exactly. I'm on the same page with you there for sure. So you were saying how when you started undergrad, it was kind of a rough transition academically. How was your transition to dental school? And you probably had a lot of background knowledge coming in with the master's, but can you talk a little bit about like first year and adjusting and how all that went?
Yeah. So it's funny because adjusting into dental school, it was easy and it was hard at the same time. So the way our school works is you take your big science class, like that's like cumulative with, or I guess integrative is the correct word, with all the different biochem, anatomy, histology, the first day you get there. And so the second week of school, you have this huge pretty much final with all the information. And I ended up not doing so great on that test. And I was like, oh my goodness, I just did all this work. I got here. Like, am I supposed to be here? Like, why am I not doing well? But the difference between that and undergrad is not like, first of all, I knew how to ask for help. And second of all, I knew where my priorities were. I felt like in undergrad, I had so much free time, yet I also had so much that I was doing. And I don't regret going to the big football games every weekend and being in a sorority and everything. But I really buckled down in dental school to where, like, I know a lot of other dental students can probably relate, but every single Saturday and Sunday, like I was studying 5 to 8 hours by myself. Like I knew that I had to buckle down, and it wasn't like I didn't have time to just sit there and be like, oh no, am I going to get to like be successful in this or am I not? Like you have another test, the ducks, like next week. And so I would say the first 2 weeks was a hard transition, but after that, I was just like, nope, I'm here. I'm going to do it and I'm going to get it done. And so it was definitely good that I did have that master's under my belt where I knew how much work I had to put in to be successful in a doctoral program.
Well, that's awesome. Kudos to you for how hard you worked. I'm sure you feel like, at least for our program, like we don't have as much didactic work now in third year. Is that similar for you?
Yeah, so I was told that we weren't going to have a lot of didactic work, but I feel like we kind of do.
Mm-hmm.
We take a pharmacology course second, third, and fourth year. And so right now we are deep into our big pharmacology course. And pretty much every day we have we have a 1 hour didactic course, and then Mondays through Wednesdays, all morning are didactic. So it's a little bit more than I expected, but definitely I appreciate the time we do have in the clinic now.
Yeah, I also thought we'd have even less classes than we do, but it's like pros and cons because we don't really have any general science type classes. I know pharm is like they get dental specific, but it's also kind of like how everything's affecting
Mm-hmm.
systemically mechanisms of action. Like we only took pharm D2 year, and I kind of wish we like did have it continually because it's on the boards like really heavily. And I forgot everything already. So I'm gonna have to relearn it all for boards. So like that is nice that you're gonna know that stuff really
Mm-hmm.
well. But it also means like week to week, you're more stressed than like us that don't have that class. So it's like weighing out
Yeah.
those pros and cons when it comes to like the different programs. And that kind of leads
Yeah.
into what I was going to ask you next too, but go ahead.
Mm-hmm.
No, go
I
ahead.
was going to say, just like, yeah, definitely pros and cons about it. And so actually, I've been speaking with our professors. And so usually we have it pharmacology fall of second, third, and fourth year. But by the time the fourth years take pharm, they've already taken the boards. And so they're talking about moving our fall D4 year pharm to the summer of next year. And so we'll see what happens. I think the class is kind of split because usually summers are known to be easier and not have any didactic classes at all, but it would be beneficial to have it right before board. So we will see what happens with that.
Yeah, that's interesting. Like that curriculum is so dynamic and changing from like year to year because the people
Mm-hmm.
above you might have had a class a certain way or had a different professor, but then they decide to change the curriculum and you might be like the guinea pig of the new system and you just have to kind of
Yeah.
go with it.
Yeah. And even kind of going off of that, I was actually just looking at our schedule for the spring, and they added a 1 hour like boards review class. And it's the first year that anyone at our schools ever had that. And so we'll see how that goes. We're kind of just the guinea pigs for that to see if it's helpful or not.
I'd imagine it would be helpful, but I guess you never know. We don't have anything like
Yeah.
that, so it seems cool.
Yeah. Well, I think theoretically it would be helpful. At our school right now, like, to be completely honest, like attendance isn't mandatory. And so most students learn on their own anyways. And so there's the debate on whether or not like it'd be more beneficial for them to do independent study or study in a group setting in a lecture hall. So we'll
I do
see.
get that because most people are going to buy like a test prep class and do all that
Mm-hmm.
anyways. So it's like, do we need the 1 hour of school?
Yeah.
I can see that. So I was going to ask you, what was the things that kind of drew you to your school? What did you love about your program? And like, what made you choose to go there?
Mm-hmm. So definitely the main thing that drew me to my school was the city. I am married, and so I wanted to be somewhere where we could root our family. I love Dallas. I love Fort Worth, the DFW area. So that was one of the main factors. Another thing that's kind of funny or ironic is our school's kind of known to be the like didactic heavy school, like very like the smart school. I mean, they're all smart, but and so like I was like, yeah, like I want to go to like the really good school, but then now I'm like, oh, this is hard, man, like and so yeah, that's kind of ironic, but yeah. Another thing was our school was just getting a new clinic, and they actually, like, the years we came, they like totally switched the curriculum. And so it was good to know that I was going to a school that was constantly changing and adapting and not keeping the same curriculum in ways that they've always had. So that was something also that was important to me.
Yeah, that is interesting because it's like the things that drew you there are what can be frustrating for you in the moment. It's like a hard
Yeah.
curriculum, the curriculum changes. But honestly, I mean, it sounds like your curriculum is really well structured right now versus like sometimes I'm
Mhm.
like, why are we doing things the way we're doing? Or why don't they help us more with this? So I don't know, like every school has its pros and cons for sure, like we were saying
Mhm.
earlier. Do you feel like there's anything you expected out of your program or like heard about it that hasn't been lived up to expectations?
Yes, I'm like, what am I allowed to say? So I am class president, and being class president, I've learned so much that like I never knew that I even wanted to learn. But one of the things that's difficult is for our clinic, we do the partner system. And so once you're a D3 and a D4, you're partnered together. And the mindset behind that is every day you will be together, and the D3 and the will learn from the D4. So you'll never be doing a filling by yourself. You'll never be doing a crown. Like, there's always someone there to kind of mentor you. The biggest problem with that, though, is you are assisting. I thought I was going to be assisting 50% of the time, but really I feel like we are assisting 75% of the time or more as a D3. And they kind of don't let you like spread your wings and fly. And so now, like, at this point, in my opinion, I like, whenever I'm doing cleanings, I really don't need someone there, but my D4 has to be there technically while I'm doing that. And it kind of seems like sometimes a waste of time. And even for her, like every single one of her appointments, like I have to stay through the full thing. And yes, I learn, but to a point, I'm like, man, I just like want more patience and more hands-on time. And so that's, I think, something that has been a little frustrating. And I get the idea behind it, but at the same time, I'm like, it just becomes a little monotonous.
Yeah, I know. Like the other dental school in Michigan, Detroit Mercy, has a similar system to that. And then ours is just a free for all. Like,
Mm-hmm.
and the cons of that is like a lot of times when doing things completely alone and like I don't have an assistant or you don't have a lot of guidance or whatever. So it can be challenging in that way. And even because we just get like a pool of patients all to ourselves, like 20-ish people
Mm-hmm.
usually you start out with, and you progressively get more. But like some people had really complex things first day of clinic that they had to start working on. And then other
Mm-hmm.
people had, like me, had like no work to do until like November, and we started clinic in May. So it's hard if we were able to do more treatments with the fourth years and at least get hands on that way or have work on their patients while they mentor us or something.
Yeah.
So it's like never going to be perfect, but there's got to be like a happy medium or like a sweet spot that some
Yeah.
schools should figure out.
Mm-hmm. No, and I've even talked to like the deans and higher ups at the school about it. I'm like, what if y'all even did this where it's like partner system, like for every summer to fall, and then in the spring we can be by ourselves, or like partner system only in the summer up until like October, November, because I understand, like, whenever I was doing my first filling, I'm so glad someone was there. And even just to affirm me in things like so simple, like, oh, how long am I supposed to cure this for? 20 or 40, So just like having someone there to know that I am doing it like correctly, and I'm not having to second guess myself, and, make me feel more confident. But some of the feedback that I get is, for our school specifically, there is not enough chairs for every student, every D3 and D4 to have a patient at the same time. And other feedback I get is there's not enough professors for every student to be working in a chair at the same time, because now we have probably, like, we are a group practice model. So there's pretty much six little, we call it, like, if you imagine six dentist offices at our school, and each student is put into a different dentist office, and we work like separately. So my little dentist office group practice, there are probably 3, 6, 9, 12, like 15 chairs, and only half of them are being used, but they say, oh, we can't fill the other ones because there's not enough professors and stuff like that. And so stuff like that gets frustrating because there's never going to be a perfect, clear-cut answer. So
Yeah, I think many schools are dealing with that faculty shortage. We certainly are. I've heard it from other people I've talked to as well. And it makes it so hard because then they put restrictions on us for scheduling patients because you're not going to get enough attention if you were there or whatever. So it's definitely really challenging. And for us too, I think we have 30 chairs per little clinic and there's 4 clinics. So that's like 120, but there's 260 students, third and fourth years using the clinics. Like we're only allowed to see 4 patients per week and up to 2 extra, whether you're same daying, like sharing a patient with a fourth year, or if it's like a 24-hour last minute availability thing. But most people see 4 to 5 patients a week. And it's just like crazy for third years. And then fourth years, you could see 6 to 8 patients. But like you go on external rotation fourth year and you see 30 and you're in a real office and you're seeing so many people. So it's so strange how schools work with just the restrictions that are needed to be in place because of shortages or just that they choose to have.
Yeah, I did have a question for you. At your school, do y'all have like a time limit for each appointment, or how long are you allowed to schedule each appointment for?
Yeah, we basically have a morning and an afternoon session. So the morning is 9 to 12, and then the afternoon, right now it's a 4-hour slot, but it's going back to the pre-COVID schedule, which is going to be 2 to 5. So they're both 3-hour slots. And if you can get it approved, you could split it if you know it's something really quick, like just a prophy or like a simple crown delivery that you know is going to go smoothly, something like that. You could split the 3-hour into 2 patients, but it doesn't really work because of the faculty shortage right now. Like my 1 o'clock appointment doesn't begin until like 1:35 because you're waiting for a start check. And for us, we can't touch the patient. We can take their blood pressure and talk to them, but we can't like do an exam yet. We can't do anesthetic. We can't literally do anything because the faculty hasn't approved that they're like safe to have treatment on. And I know like my friend at Case Western, they can do anesthetic, they can do everything. They just can't start drilling all before a start check.
Oh, interesting.
So I don't know if they have like a pre-rounds type thing where like they at least know that they're like medically okay to get anesthetic. I don't really know how that works. But for us, because of the shortage, there's probably like 7 to 8 students per faculty right now. Sometimes if someone doesn't show up or someone quits or something, then it's like 15 for one faculty. And when it is like the 7-to-1, if you're first on the list, you get started at 105. But if you're 7th on the list, you might not get your patient numb until 2. And then you only have like 2 hours left, which is still like a lot of time, but it runs slowly because then you're waiting for the next check and the next check.
Yeah, no, if you're definitely last in line, it is frustrating and then you feel more anxious, etc. One thing too, I would like to say is last year we really pushed for more faculty. And even though we are not where we want to be with numbers, I was really like I'm satisfied in the answers that our admin gave us, because we were at a weird point at our school where our school wasn't wanting to hire any part-time faculty. And we like as students really pushed for that because we were like, first of all, like we need people. Second of all, there are dentists who only work 3 days a week or 4 days a week who would love to come to the school and teach. There's just not opportunities. And so this year we've got a lot more part-time faculty, which has really helped, because before expecting people who went to dental school who love private practice to drop everything and come and work full time, I feel like is asking a lot. So that's one way our school has moved, I feel like, in my opinion, in the right direction.
Yeah, that's awesome. And I think I love the faculty that's part-time that's still working because they have so much more perspective to give because they're out there doing clinical dentistry all day. They're not doing research or only in a dental clinic.
That's literally what I've told so many of our admin. And I had these conversations to where I told because I love talking to this faculty and the dentist. And I'm like, oh, so what do you love about dentistry, or why did you come here? And with so many of the full-time ones, love them to death. But I have heard, oh, I hated private practice. And me knowing that's what I want to go into, I'm like, oh, nice. Like, like you do need people who are still working in the dental field, not only like to encourage you and motivate you, but knowing the new like technology and what's working and what's not working in this time. And so I appreciate that so much too.
What do you want to do after dental school? You mentioned like you worked in some specialty offices. Do you want to specialize or general dentistry?
I want to do general dentistry all the way. I'm
Me
super
too.
passionate about wanting to do that. Yeah. It's funny because the other day someone asked me, they're like, so what do you want to do after you graduate? And I was like, I think I want to have a kid. And so I'm 28 now and married. And so I think I am ready to just have a job and start a family. I love that general dentistry. You can do everything, pick what you really like to do, and you can still focus on that. And so I am excited to hopefully go into a private practice with general dentistry.
You kind of mentioned being married, so I'll just ask you about that now. Like, how has the personal life and school balance been? Like, how did you establish, like, I guess, good boundaries and support with your partner, like going into such a rigorous program? I don't know, like, when you got married and everything, but if you want to talk
Yeah.
about that.
So I got married July 2020. We had a COVID wedding. And so our whole wedding got postponed, which is fine, but we still had a backyard wedding with just my husband, Gabe, and my two parents. So that was July 2020. And then we started school August 2020. So there's just so much to it. First of all, I'm so lucky that I am married to one of the nicest, most servant-hearted people. When it comes to being like, I don't know, a housewife, homemaker, I'm the worst. I don't like to cook. I get really messy and stuff. And so I'm very thankful that every night, most nights when I come home, he has dinner ready for me and like really like he understands where I'm coming from. And like at this point in my life, like it stresses me out to cook. And like when I come home, I have like sometimes 1 or 2 hours with him and then I have to go back to studying. And so he's really understanding. But on the other side, just me being hard on myself, first year that was really hard on me, being like, am I being a good enough wife? Like, like trying to have my priorities straight and knowing, like I said, on Saturdays and Sundays, it was two full work days of studying because I knew that's what I had to do to succeed in my classes and stuff. And so just having that balance of like not being too hard on yourself, I think even now I still struggle with it, but I have to keep reminding myself, like, I didn't marry someone who's putting this pressure on me to always be there and be like the stereotypical like housewife. And so like, I don't need to put pressure on myself like that. And so that's kind of how it's been. Just for me personally, it's been really great. I think if I wasn't married, I would eat McDonald's every day, like come home and like, I don't know, binge Netflix. And so, which is fine when people do that, but it's also taught me to really appreciate the time I do have with Gabe because, being in dental school, we don't have as much time as other people our age and stuff. And so, yeah.
How's the like spread of like life stages in your class? I feel like for us, we have like the handful of people that are married. We have the handful of people that are
Mm-hmm.
like young and single and still like go out and go crazy all the time. And we
Yeah.
have just like, we have all the things. What's like your class dynamic?
Yeah. So it's funny because I thought we'd have a lot of like older people and we really don't. And so I'm 28. I guess I started dental school 25 or 26. My friend group, I am the oldest girl, which I always like laugh about. One of my friends, I'm gonna throw her out there, but whenever I met her, she was still 20. And so I remember being 26 and telling like my old college friends, like, yeah, I'm going to a 21st birthday party. And they're all laughing about that. But I would say mostly young and single and but we do have a few married people. I was even talking to some of my friends about just like our distribution of like people who have kids. And so I think there's like maybe only 3 people with kids and they're all guys with kids. And so I don't know. I think it would be cool to see, or like, I like to see like how women who have kids like navigate dental school and stuff, but it's not as prevalent at our school. So yeah.
Yeah, we have two, I think only two dads in our class with young kids, and then
Mm-hmm.
two women in my class. One had a baby in July, one had a baby
Oh,
like 4 or 5 months ago. And then another one started dental school with 3 kids, one like the month before school started. So we have three
wow.
moms with young kids and then two
Oh,
dads. So, but I
yeah.
think it just is, it's just interesting to see. But I think it's been nice. Like our administration seems to have been like reasonably supportive of them and like letting them take a little
Yeah.
bit of time off. But like there's only so much they can do. They're like,
Mm-hmm.
well, take the time off, but make sure you get everything done just like everyone else. Good luck.
Yeah. So even thinking back about it, like my D1 year was all on Zoom. And before my D1 year, class was 100% mandatory, assigned seats, like very strict. Like they've gotten so laid back now, where to the fact, I feel like it would be a lot easier to have a kid now than pre-COVID at my school. And even one professor was saying that some people really wanted him to make class mandatory. And he was like, no, like if you can watch my class later on Zoom and you have kids and like you need to stay home, like I want you to be able to do that. And so like I appreciated him saying that. I think there was a D4 who just had a baby, and I think I don't know her personally, but I think they only give like 2 weeks leave absence, which is really, really tough. And then you have to come back, which not the best atmosphere, I know. So
Yeah, it's hard. And even whether it's dental school or after, like I just had a presentation with a woman that's a periodontics resident that had a baby at the start of residency, and they offered her, I think, 6 weeks, but she only took like 1.5 or something. So even if you're
yeah.
offered something, there's a lot of just general pressure to not
So
do that, or pressure you put on yourself. So you don't want to get
mhm.
behind. So it's a
No,
tough situation.
I love that you brought that up, because we had a panel one day where one of our ethics professors brought in just a diverse group of faculty to answer any question. So we could ask any of them, and it was anonymous. And my question was something along the fact of like, oh my goodness. So I'm trying to think, but it was basically like, if you are a woman who's pregnant and you're going like into a private practice, like, how do you deal with the guilt? Because like, honestly, like I feel guilty thinking about the fact that, oh, I'm going to start a job and might have a kid soon. And I know I shouldn't, but society makes you feel like that. And, but I also want to respect the people who just hired me and not leave them out to dry. And so there's just like both sides to it. And the best answer ever, it came from one of our male faculty, and he was like, nope, let me take this one. I want to take this one. And he said something along the lines of, who all birthed you? And he was like, your mama, like your mom birthed all of y'all. And he was like moms are the ones who like help like grow the next generation and like nourish everybody and stuff. And he was like, I rather have a mother working with me as a partner who like cares for our patients and like nurtures them and just like has that passion than have a male or anyone else who doesn't like have that love for our patients. And so like he'd rather have that person who takes 6 weeks, takes however many months they need. And so I really appreciated that, because there was also someone in my class who like said something along the lines of, well, wouldn't you lose money if you hired someone who is pregnant and they left for 6 weeks? And he was like, no, you'll make so much more money with the patient retention of having someone who's, like I said, loving and caring, and they leave for 6 weeks. So I appreciated that. And he said it way more eloquently than me,
Mm-hmm.
but I hope it gets the message across.
Yeah, that's awesome. That is really great. From what I've heard, it seems like the practices are understanding and like some excited and happy for you, and
Mm-hmm.
love that about someone that's going to be a mom and like a parent. Cause I think that's really like relatable to patients too. And they like enjoy those kind of care providers. But the one thing that I think people have to think about is that pretty much no contracts have paid maternity leave in them. So
Mm-hmm.
if you have student debt or something, you need to have money set aside to pay your payments when you're not getting income. Like if you are going to take 2 months off, like you are unpaid for 2 months. So
Yeah.
on top of whatever you're saving to pay for a baby, you have to also prepare for that as a woman in dentistry, unfortunately.
Yeah, no, that was something else that one of the women dentists pointed out, and so many people in my class were shocked. I kind of knew that, just like, follow all these people on Instagram and Facebook and learning about how the field works. But yeah, it is something that people aren't used to. Just another thing that one of the dentists pointed out that I thought was cool. She was like, if you are like worried about not like working for so long and like leaving your practice like with no one, she told me that she used like a Facebook group for dentists who are moms, and there's dentists on there who that's what they like to do. They like to go in and like be like temporary dentists for moms on maternity leave, and then the rest of the time they're spending time with their children, or. And so I was like, oh, like I didn't even know there was like services for that if your office was willing to like do something like that.
Yeah, definitely. Because I think about being a solo practice owner at some point, and what if that's also the same time I'm having kids? It's nice to know that there are those temp agencies out there, and like you have the guilt of like whatever being away from your baby, but then being away from your patients. It's like,
Yeah.
but it's nice knowing that there's people out there that can take care of the patients, because you're only going to have a baby for so long till they grow up. So I definitely think about all the motherhood stuff a lot too. So it was fun to kind of chat about that
Yeah.
for a second. I have one more question for you, and then we'll kind of wrap up. So now that you're in your third year, like we're almost done with third year, like one more semester, is there anything that you're looking forward to with the rest of time in dental school?
Yeah. So honestly, I'm just looking forward to, as cheesy as it sounds, like really learning and like getting like proficient in what I'm doing. And so right now, like whenever I feel satisfied that like I did a good job and the patient leaves, like it's usually like, oh, a cleaning, like I cleaned their teeth, I did a good job. Now I know that they're healthier. If someone comes in pain and we have to extract a tooth, take out the tooth, like that you did a good job and they're like leaving out of pain. But I feel like with like fillings and crowns, more of the restorative stuff, the patient leaves and I'm like, oh my goodness, I hope they don't have to come back, or like I hope they're not like still in pain later and stuff. And so I just like look forward to like being more confident in myself and like really like becoming more proficient in what I'm doing and know that I'm doing a good job. And I know I'm not going to leave dental school an expert or anything close to perfect, but just being able to like have a patient leave and like have that satisfaction without still worrying about them all night is one thing I'm looking forward to.
I feel that the stress and like the empathy you have for patients like follows you around. It's a lot.
Yeah.
So wrapping up here, well, first off, do you want to let people know like the best way to get in touch with you or to like follow your dental school stuff?
Yeah, so I am active on Instagram at Road to Raina D Dentistry. And so, oh my goodness, that's not even it. That's my handle for after I graduate. That's me.
You
Wait,
have it
what did I
ready.
say? Yeah. I can't even remember it. Road to Raina D Dentistry. Yeah. Okay,
Yeah, that's
ask me
right.
again.
So before we wrap up, I have one final question. But before that, do you want to let people know like the best place to follow you or like reach out if they have any questions?
Yeah, so I am active on Instagram at Road to Raina D Dentistry, and it's at road underscore to underscore Raina D underscore dentistry.
Perfect. And I always post like the episode stuff and I'll tag you. So that'll be easy for them to get to it
Awesome.
as well. So wrapping up, do you have like any message you want, like a take home message, final advice you want to give to people listening?
Yeah, for sure. So, in this episode, or even really in life, I try to be vulnerable. Like, I'm not trying to make it seem like I'm the perfect student or the best student ever, but I just want everyone to know that, like, if they want to be a dentist, like, you can be a dentist, you can find a way. And so, don't let anyone discourage you, because you'll hear different people telling you things, you'll see different people posting things, making it look all easy. And just if you want to do it, there's a way. Find the right resources, find the right people to surround yourself with, and go and do it. So, yeah.
That's awesome. And I really do admire how persistent and passionate you are. Like I can just tell from this short conversation. So that's an amazing trait. It's going to take you far in life. And I'm
Thank you.
happy to get to meet you. This was so fun. Thank you again so much for your time tonight. And yeah.
Thank you, Haley. It was nice to meet you. And I hope to see you in the future, maybe at a CE course or something, and our paths will cross again.
Yeah, that'd be awesome.